See, you're standing there ready and the scope's in the patient. So they're sedated. So we have a couple of minutes. What I'm going to train you today. What would you like to gain out of the session, Thomas?
Yeah, this patient actually is resembling the thing that I said a few minutes ago. So it's a patient with an abdominal surgery. So this patient had a prostate cancer and had a cystoprostatectomy with a Bricker ureostoma. So yeah, this is one thing. So with abdominal surgery, what specific measures I can do prior to the procedure, so by positioning the patient, or during the procedure. Also recognizing not particularly loops, because I think, yeah, I may identify them correctly, but of course I can make mistakes. But so these bowing effects, like anterior or lateral bowing, how important are they when I should intervene if I recognize them? And yeah, the third one is efficient use of time during withdrawal.
Okay. Well, we can certainly cover all of those things during the procedure. To some extent, things are what we call opportunistic, Thomas. That means when they occur, we deal with them, and that becomes a point of learning. And if some of the things you've mentioned don't occur, then I can't teach you on them, although we can do it in a didactic fashion. But for someone like an interesting starting point is your selection of your colonoscope. Now, I appreciate some people may not have an option to select a colonoscope, but others do. So can you think of the factors that might influence your choice of colonoscope, and what have you chosen for today, or have you just been given one?
I have been given one. It's an EZ-1500 colonoscope, CF.
It's a CF, so it's an adult colonoscope. Okay.
Yes, not a PCF or yeah.
So what would you choose if you had choice, do you think? And why?
Because of the surgery, or because of the is this the question regarding to the surgery?
It is relating to the surgery. That is correct.
Yeah. Well, actually, I don't have a firm knowledge on that, but if I hear this question, it suggests me that maybe a PCF would be a better solution or a better choice.
Why have you said that?
Well, because it's well, PCF is 1.5 millimeter less in diameter.
So do you think there's going to be a stricture? Is the diameter of the lumen going to be an issue?
No, actually not. No, actually not. Because I expect that maybe because of the surgery, well, it can have two effects. It can have breeden, fibrosis. Yeah, so it can be more like a fixed effect on the colon, but it can also be that it's more lax or more loose. Can't it?
Correct. So usually the issue during colonoscopy largely relates to adhesions and fixed pelvis. So you've had pelvic surgery here, or urology surgery. So the initial problem will be during the initial intubation through the sigmoid colon, which presumably has not been resected, or may have been in the surgery. And therefore a more flexible instrument might gain you an advantage. The paradox is with surgery around the rest of the bowel, where often their mesenteric attachments have been taken down to mobilize the colon during surgery. And as you rightly say, the colon can paradoxically become very, very mobile. And actually a fatter or a stiffer scope, an adult scope, is more beneficial. But you have what you have. This may or may not be a relevant factor. The other thing that might help you if there are adhesions is definitely using an underwater technique. And the third element that might benefit you is having a distal attachment, and specifically a cap, because that will give you 2 or 3 millimeters away from the mucosa. And what that will allow you to do is have a better visual understanding of the direction that the lumen is going, when if it is fixed or angulated, that might be challenging without the cap. So is there a cap on the instrument?
It is.
There is.
A
And
trans-
do you use underwater colonoscopy intubation?
Since I'm here in Ghent all the time.
All the time. And do you remove all the air pockets as you go?
I try to always, yes.
Fantastic. I'll tell you what I'm going to do, Thomas. I'm just going to let you get started and just let you scope for a couple of minutes. And during that time, as you're scoping, if you